Hello, I'm Dr. John Citizen. Today I'm here to tell you about some frequently asked questions about the drug, crystal methamphetamine, or more commonly crystal meth or ice. My assistant will show you pictures along the way, to show you what different things look like, and so on and so forth. Let's get into it. First question. How will crystal meth affect your body? It affects the different structures in the brain, but attacks structures that contain the chemical dopamine. This is because the shape, size and chemical structure of dopamine are similar to crystal methamphetamine. Dopamine is a chemical which makes you feel good. The dopamine is absorbed by the neurons, spreading the pleasure across your nervous system. Because methamphetamine is similar to dopamine, it fools the neuron into absorbing it. This makes the neuron release more dopamine, giving you a high which can last all day. Afterwards though, you stop feeling the pleasure, leading to the person consuming more crystal meth. This may lead to difficulty enjoying other things such as your favorite foods, time with friends, etc. It then starts to affect other parts of your body. Another question. How is crystal meth dangerous to your long-term health? You have a higher blood pressure and an increased risk of heart-related complications such as a heart attack or heart failure. You have a weaker immune system and a higher chance of catching infections due to sleeplessness or loss of appetite. Your mental health starts being affected, causing depression, anxiety, tension and paranoia. Even your teeth are affected, because of the constant grinding of crystal meth in your mouth. If you smoke it, it damages the lungs. Snorting it damages your lungs. Injecting it leads to scarring, abscesses and vein damage. If you share equipment that hasn't been sterilized, you increase the risk of blood-borne viruses such as hepatitis B and C and HIV. A question similar to that is, how is it dangerous to your short-term health? As it is similar to dopamine, it can also affect other neurotransmitters, cells in the brain that transmit electrical messages in the nervous system that contain dopamine. This means that it can affect other neurotransmitters that contain serotonin and norepinephrine. This can affect how your body and brain works. It could cause sleeplessness, loss of appetite, irritability, aggressiveness, panic attacks, anxiety, paranoia, nervousness. It increases your breathing rate, body temperature, blood pressure and a faster and irregular heartbeat and excessive sweating. Now, how common is it around Victoria? In 2005, research was conducted which indicated approximately 5 of students aged 12-17 years of age have used amphetamines, crystal meth or more commonly, speed and ecstasy. Compared to alcohol and tobacco consumption, this is low. A very common question, how did it first get produced? Methamphetamine was first produced in Japan in 1893, by a chemist named Nagai Nagayoshi, by synthesizing from ephedrine, a chemical which can be used as a stimulant or decongestant. In 1919, Akira Ogata synthesized methamphetamine by reducing ephedrine with red phosphorus and iodine. These are the basic facts and history of crystal meth. Now for questions related to consequences of possessing of the drug, and the consequences of consuming it. How can you be charged if you are caught in possession of crystal meth? Methamphetamine is a restricted drug, which means that it can only be prescribed by a doctor. It is an offense to possess these drugs, make false representations to obtain crystal meth or fill in a prescription without the doctor or any other authorized person. If caught in possession of any drug, it is a $3,000 fine or 1 year of imprisonment, or both. Time for the next question. How would you deal with a person who suffers from the effects of crystal meth? It depends on what is happening to the person suffering from the effects. If that person is having a heart attack, call 000, and if you know how to perform CPR, cardiopulmonary resuscitation, to perform CPR, tilt the head back and open the mouth. Pinch the nostrils to prevent air coming out. Place your mouth over theirs, making sure it forms a seal. Then do 2 initial breaths. If this does not work, find the sternum, the heart part in a person's chest, and do 30 compressions, with one hand on the sternum, the other hand supporting it. Then do another 2 breaths. Keep repeating until conscious or the ambulance arrives. And finally, Who would you go see for a person suffering from the effects of crystal meth? If the person is suffering the mental and physical effects of crystal methamphetamine and would like help, you can contact direct line on 1-800-888-236, a 24-hour service for counseling, information and referral service. You can also contact your local drug referral and counseling service. There is a list on the Victorian Department of Health website. You may also see your local doctor or health service. Thank you for listening to this education presentation about the drug crystal methamphetamine. Now for the disclaimer. This educational presentation was produced by E-Man Incorporated and may not be used for public viewing unless approved by E-Man Incorporated. Copyright 2010,